a lot of products have enzymes in them, like random enzymes. Just ignore those. Those are not helpful. Regular enzymes don't kill fungus. Hi, I'm Dr. Mona Morstein. Welcome to my channel. I've been in practice for 36 years. Today, we're going to talk about fungal overgrowth in the entire intestine. If you're not a subscriber, please click on the link below and let's get started. So, fungal overgrowth is so common in American and probably worldwide guts. Now, there are many different fungal species in the intestinal tract. Candida is the most common one, and many of you have probably heard of Candida albicans, but there's also Candida krusei and Paracephalus and glabrata. There's other different kinds of Candida. Then there's also species such as Rhodotorulum and Geotrichum, Saccharomyces boulardii. These are fungal species, and while in a healthy gut, they're kept just to a little low amount, these can really overgrow. Now, they come in three shapes. There's buds, and then pseudohyphae, and then hyphae. Now, when they're in the hyphae, kind of proliferating stage, that can actually enter into the lining of the intestine, like the small gut, and cause inflammation and leaky gut. So this can be a very big problem. Fungal organisms also make a lot of toxins. They make acetaldehyde, which is kind of a breakdown product of alcohol. And if you're making a lot of that, it takes numerous nutrients to break that down, like B1, B2, iron, molybdenum, vitamin C. So these are nutrients that you're wasting in your body just to break down the toxins of this fungal overgrowth. But it also makes oxalic acid and tartaric acid and arabinose. These are propionic acid. These are toxins that fungus inside you make in the gut, and then they secrete these. And particularly if you have a leaky gut, which many people do, but these can go through the gut and enter your body. And that's when we call it systemic yeast. You don't actually have fungus in your body. You've got kind of their poop and pee in your body, right? And they cause symptoms. It's very pro-inflammatory. How do we get this situation happening? Well, there's several etiological factors. Antibiotics. In fact, there was a study by this guy Nigel Plummer in England who found that one dose of an antibiotic without some probiotics given allowed yeast to overgrow and get into the actual lining of the small intestine. One dose. I'm a naturopathic physician. I've had more than one dose of antibiotics in my life, right? So the more antibiotics you've had, particularly if you're like, well, you know what? I get a yeast infection when I get an antibiotic. Well, if it's happening vaginally, no doubt it's overgrown in your intestinal tract. Also, birth control pills can cause yeast overgrowth. Eating too much refined sugar, drinking too much alcohol, glucocorticosteroids, right, which kind of decrease the immune system and yeast can overgrow. Patients that are just immunodeficient, proton pump inhibitors, tobacco is associated with an increased fungal overgrowth. And also, if you're overweight or sweaty, a fungus will love to grow there, whether it's under your breasts or in your groin or on your feet. Athlete's foot, sweat and heat can enhance fungal overgrowth, particularly in that regard, of course, on your skin, right? Now, what are the symptoms that you have fungus? Well, if I hear a patient say, wow, I get some bloating, I get bloated, and I have brain fog. So those are two key symptoms that I'm immediately going to think fungal overgrowth because of that brain fog from the acetaldehyde, right? And so I'm definitely going to think, oh, this could likely be a fungal overgrowth, right? They also headache, achy muscles. I've had patients who couldn't work out because when they worked out, it felt like they got the flu, and it was fungal overgrowth. And when we got rid of the fungus, they could go exercise like they were 20 years old again. Interstitial cystitis, because we can collect ideas of fungus in the urine, and some of their toxins can be in the urine, and that can cause interstitial cystitis. Obviously, getting yeast overgrowth, getting the vaginal yeast, getting the athlete's foot, getting tinnias, having it grow on your body. Hives is associated with fungal overgrowth. A burning tongue, even without actual thrush, and of course, thrush is a glaring symptom of overgrowth fungus, but even without thrush, having a tongue that's burning is an indication of yeast. And then constipation. In all of my 36 years of practice, fungus has been a constipating microorganism. Also remember, fungus is very closely associated with people who have SIBO, right? Now, how do we diagnose fungus? Well, we can do a stool analysis. A stool analysis showing fungus means you have a fungal overgrowth in your colon. We also have a questionnaire. The official questionnaire I like is the 2-page one from Dr. William Crook's book, The Yeast Syndrome, which was written in 1984 and told us, hey, there's fungal overgrowth in the gut. So I love his 2-page one, but there is a shorter one I don't recommend you use called the Fungal Related Disease Questionnaire, which is just seven questions. Just do the full 2-page one. Now, if the stool is negative for fungus, but the questionnaire is positive, that's how I'm helping to diagnose small intestine fungal overgrowth, because there's not a study for that we can do. There's not a test. We can do an organic O test, which will pick up various fungal metabolites, such as the tartaric acid, the arabinose, and there are some docs who do blood antibodies, and an IgM Candida antibody would mean it's kind of growing right now. So you've got symptoms, we've got a diagnosis. How do we treat this? First, we've got to be on an antifungal diet. Now, don't go online to Google as an antifungal diet. They're so strict, and it doesn't have to be that strict. So I've been using this diet for 36 years, and it works fantastic. First, of course, we do avoid refined sugar. You can have stevia, monk fruit, or allulose, xylitol, etc., but just refined sugar as it comes, right? We also avoid concentrated fruit like fruit juice and dried fruit. You can't have fruit, a regular piece of fruit, for 2 weeks, but you can then add a piece after 2 weeks, but you can't have a banana and other things that are fruits like olives, cucumbers, avocado, coconut, tomatoes. You can have those all month long. With grains, we have gluten-free whole grains without yeast or sugar in them. So brown rice pasta. I have a list of breads that patients can use on this diet. They can have quinoa and millet and so forth. Oatmeal is okay. We avoid peanuts, pistachios. All the other nuts are fine. We avoid white potatoes and mushrooms. All the other veggies are fine. Beverages, water, fizzy water, coffee substitutes, because we avoid coffee. Any kind of tea and unsweetened alternative milks are fine. And we avoid alcohol and vinegars, right? We're doing that diet for 1 month, and then we combine it with antifungals. Now, there are drug antifungals. My favorite is nystatin, and I use that with almost everybody. It's super safe because it's an antifungal, so it has nothing to do with the bacterial microbiome, and it's not absorbed into the human gut. So you can't have any negative reaction to it in your body because it just goes in, kills the overgrowth fungus, and you poop it out. The other antifungal drugs, which are the azoles like fluconazole and itraconazole, these are also sometimes used. I don't use them very often, but if they are, since they can get to the liver, it's good to give a little liver support if you're taking them. Like, for example, milk thistle, for example, right? Now, there are plenty of supplements as well. I'll oftentimes use Colorex, which is an herb called Horopito, which is kind of a biofilm buster for the yeast and also an antifungal. But there's undesolenic acid. acid and caprylic acid and garlic and powder arco and certain essential oils like thyme, rosemary, oregano, berberine. And then NAC, N-acetylcysteine, is a great biofilm buster and also can help kill fungal species. A lot of products have enzymes in them, like random enzymes. Just ignore those. Those are not helpful. Regular enzymes don't kill fungus. They just help digest your food. There is one enzyme, chitinase, because the cell of the fungal cell has a lot of chitin. So we get chitinase, but it's very hard to find. I couldn't track it down with my priority one company. But regular enzymes, I wouldn't bother with those. Now, of course, then we add in probiotics. So probiotics inhibit the growth of fungi, prevent hyphae formulation, inhibit adhesion of the fungus to the gut lining, and inhibit early biofilms, so it's easier to kill them. So we're always going to want to use a probiotic in this protocol, the diet antifungal probiotic. I do this for 1 month, right? And patients come back. Most of them are feeling great. A very small percentage get a die-off reaction. And a die-off reaction, if it happens, is in the first week, because it's not going to happen in week 3. If it doesn't happen in the first week, it's not going to happen. Most patients don't get a die-off reaction, say 5 out of 100. But at those 5, if it's a very bad die-off reaction and they're going to have the toxins, a big die-off of yeast in their gut, and these toxins get through into their body. That means you've got leaky gut. So we're going to have to treat that for sure. But then you're going to get headache and fatigue and achiness and all of these really bad symptoms. And if that happens, and if it's bad, I use activated charcoal. Activated charcoal binds with everything, including the fungal toxins. But they also bind with your food, with your medicine, with your vitamins, with your minerals. So we have to take 3 capsules at bedtime and then 3 mid-morning or mid-afternoon away from taking those. Some patients need to do that in that month span. Most don't. But after that month, most patients for sure are feeling better. They have more energy. They're having better bowel movements. They may have lost some weight, but they're less achy. They're less tired. It's just an improvement. So we start opening up the diet and I start reducing, but not stopping, all the fungal protocol. And so we just slowly wean them off. For people that have had bad fungus for a long time, I may keep them on a couple of nystatin every day for a while to keep it down, especially if they're not so sure they can stay away from etiological factors, right? So they can't quite avoid alcohol, or they're gonna, if I can't help them learn to reduce sugar, things like this, we may need to keep them on the antifungal, that nystatin, or a supplement longer. But that's how we're dealing with fungal overgrowth in the gut. I'm Dr. Mona Morstein. Thank you for listening. Click below if you're not a subscriber, and I look forward to seeing you on my next lecture.